Hey, all, Dr. Adam here. Wanted to hop online and go through really my newsletter on chiropractic care versus opioid treatment, and also where the current culture or the current medical guidelines are going, which is cool. And here's a little bit of a spoiler: chiropractic care is absolutely indicated for people that have pain, um, for obviously doing a natural thing versus treating just a symptom or masking it. So the research article for today is Trends in Opioid Use versus Non-Pharmacological Treatments, Adults with Pain. The study was done from 2011 to 2019, so kind of a larger, broad base. This helps set the stage for opioids being prescribed less for people with back pain. Now, I'm going to go into in America and really the world, there's an opioid crisis. There's some stats. I had to look these up. 79,358 opioid overdose deaths, and that was in 2023. That year, it actually went down slightly, but since then has continued to go up. So that's around 214 people per hour that pass because of opioid. A lot of times it starts with a painkiller. It starts with, maybe something non-steroidal anti-inflammatory. Then that doesn't work, so it takes the edge off. So then a stronger pain medication, stronger and stronger, and then eventually to really the synthetic forms of opioids are the most dangerous. Now, there's also, just to go through some of the side effects: high risk for addiction and dependence. Side effects can include drowsiness, nausea, constipation. More serious risks can get all the way into respiratory issue, as far as that, even slowed breathing to a point where a person's not getting enough oxygen. But ultimately, painkillers are masking the problem. Okay, so rather than get to the root cause of the issue, which if you're watching this video or listening to it, you're probably doing something to work on it. Now, one thing that we say often is that research will catch up to the current philosophy. So chiropractic philosophy has always been heal the body from the inside out, take pressure off of the nervous system, which is the master control in the healing system. So, that philosophy has gone unchanged for over 100 years. And now I would say that this is more evidence that the research is getting back to that, or, people are prescribing, even though this is not necessarily a chiropractic article per se, this article goes into prescribing physical therapy, exercises, stretching, heat. All of these are before an effort to mask or prescribe something to decrease the pain. So, even though this article is mainly talking about opioids, I also looked this one up. Non-steroidal inflammatory drugs, so NSAIDs, they estimate that the average is between 16,500 and 17,000 deaths in the United States every year. So non-steroidal inflammatory drugs, so ibuprofen, Tylenol, things that you can get over the counter, but are really tough on your body. The top three complications and risks are GI issues. So you can cause holes in your gut and your GI can bleed, or you can even have less of that and leaky gut symptoms. There is cardiovascular risk, especially when used at higher doses or for long periods of time. So it can increase the risk of heart attacks, strokes, and blood clots, which, again, that's the leading cause of death in America. And sometimes people, I meet people, I just take an ibuprofen every day for years and years and years. And that's just really hard on the body. Kidney problems are also, so heart, liver, kidneys, those can all be affected, the gut. But it's nice when the research kind of points back into conservative care, treat the body from the inside out. And that will always, do everything you can to help keep you happy, healthy, and strong.